In Parkinson disease, it's a movement disorder. In this movement disorder, basically, small part of the brain, which is the software, we can say, the center for regulation of the movement, how refined the movement are, how the movement is processed. The brain thinks about a movement, it has to go through a certain network. For it to be synchronized, refined, the movement has to be soft and fluid. It doesn't have to be jerky. So whenever there's a chemical imbalance in that small part of the brain, what we get is Parkinson disease. It has many symptoms like tremors are very common in hands and legs. Usually start with tremor, it can be in one hand or both hands. Then stiffness in the legs or rigidity, akinesia, you become very slow. Every action that you do is very slow. And then dementia sets in many patients. And some people get hallucinations and psychiatric complications. The main problem in the Parkinson disorder is that dopamine chemical is reduced, and that affects the electrical stimulation in the brain. So the approach is that a right diagnosis aided by the diagnostic tools like special MRI, which can check for dopamine level in the brain, and other tests and clinical judgment. You should be able to reach a diagnosis with the help of your neurologist. And then they start you on a set of medication. That medication has to be taken over time in a regulated way, very precisely and the right time as the doctor suggests. Because this is like fuel for the brain. If you don't manage it properly, the brain will not function properly. And what is known is that with time the disease does progress. Replacing the medicine, putting the patient on the medicine does not mean the disease is going to slow down. We are just managing the symptom by this medicine. And over that time, the medicines don't behave that efficaciously. The effect of medicine goes down, and invariably the side effect of medicine, which is called dyskinesia, which is a worse symptom than even Parkinson, that sets in. So the golden rule is now that for the first 4 to 6 years, till the time under monitored treatment the medicine is helping, we keep the patient on medication. And then at the right time, neurologist and the neurosurgeon decide it's the time to go in for DBS. So DBS is Deep Brain Stimulation surgery. In common language, it's like a pacemaker for the brain. We introduce 2 electrodes in the deeper part of the brain. That's why it's called Deep Brain Stimulation. We reach the correct area, and then we confirm that we are at the right area by many diagnostic tools intraoperatively, so that we are sure what we are hitting. And this is a navigation guided surgery. It's computer aided, so you know at every step where you're entering the brain, where you reach, and patient is awake all the while. And then we stimulate the brain to see the symptoms are alleviated or not. That further helps us confirm whether we are at the right spot or not. And these cables that put in the brain are attached to small pacemaker, which is placed over the collarbone, under the skin. So nothing is visible from outside. From outside you just feel something on the collarbone, and no wire is visible. And then the next step is programming of the device. How much current your brain requires. That is decided by your neurologist, neurosurgeon, and the neuromodulation specialist who is managing your battery. It has a very good outcome if a good patient selection, proper compliance. And the idea is not to stop the medication. The idea is a patient to have good quality of life with a combination of pacemaker and medication. A good treatment doesn't mean that you are off medication. A good treatment means that your symptoms are managed, whether it's by medicine alone or along with pacemaker.